Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice. The detection and rapid spread of a new clade of mpox in eastern DRC, its detection in neighboring countries that had not previously reported mpox, and the potential for further spread within Africa and beyond is very worrying. In addition to other outbreaks of other clades of mpox in other parts of Africa, it's clear that a coordinated international response is essential to stop these outbreaks and save lives.
Ladies and gentlemen, my name is Kwadwo Sheldon. The head is big for a reason. Now, this is not your hour of the day. This is not bant and rant. This is not your hour of the day, but it's an extension of your hour of the day. Now, this is going to be an educational episode because I know most of the people in the comment section, especially the boys for the WhatsApp group and the girls for the WhatsApp group, then they need them. And this is what our platform, they do. We educate people, we entertain people, and this is what we do. So it is important I bring in experts to come and sit here and have a conversation about this topic. Now, I'm sure you have seen it in your newsfeed and you are wondering what is happening, because what we are used to is chicken pox. And I have a mark on my body like that, where, okay, mine is here or something like that. And they say you get it once in a lifetime. If they can't get them twice, there's a problem. I don't know who brought about that thing. But yes, there is another pox in the system. And bro, people, they record numbers, and people are even asking for another lockdown, because people just don't want to work and things. But then we need to know what is happening when it comes to monkeypox. It be monkey carry come. What is monkeypox? So, ladies and gentlemen, in the studio here with me, I have two medical doctors in the studio. Yes, today we are not coming to do giddy giddy. We are coming to explain things to you. So I'm going to let them introduce themselves and we'll have a conversation. Big man, what's your name, bro?
Okay, so I go by the name Senyor Kumade.
Okay.
Yes, I'm a medical doctor, a footwear plug, and also a content creator.
This be the doctor I do. They say they love, they sell sneakers more than being in the world, because every day on Monday, please, Ghana Medical Association, don't come for him. Don't come for me. He dey work. Big man, please, what's your name?
Yeah, I'm Apama Piggy Gregory. So I'm a clinical oncology pharmacist.
Okay.
And also I'm a health content creator.
Okay.
Yeah.
All right, ladies and gentlemen, so we are going to have a conversation about monkeypox, and I'm sure you have seen it trending in your newsfeed and everything. So, big man, monkeypox, what is it about? I know this is not the first time we are seeing something like this, because I think 2022, there was a news item like that said we have recorded about 50 cases or something like that. Then for it to die down in 2024, it is like in a system, the Ghana Health Service or the Ministry of Health, they have issued a presser with regards to what is trending right now. So monkeypox, what is monkeypox?
So monkeypox basically is a viral infection, which is contagious, and it belongs to a family. So it has, let's say, brothers. An example is smallpox. So monkeypox originally was found in Denmark. That was in 1958. And the first human case was recorded in Democratic Republic of Congo. Yeah, that was in 1970. But since then, there have been cases. And in Ghana, I think our last case was in 2023.
Oh, okay.
We had like 8 cases. In 2022, we had like 108.
108?
Yeah, cases. Okay. But when the numbers rise to a certain point, WHO begins to sound alarm.
Okay.
And we call it a global emergency.
Okay.
So that's what is happening now. Because the numbers are increasing. And when it comes to monkeypox, it has certain signs and symptoms. I'm sure we will get there.
Yeah.
But basically, it's a viral infection, which is contagious, which also resides in certain animals like monkeys, because they are the first organisms or primates that had that organism or virus cultured in them.
Okay.
Yeah.
Big man, so it means say it be monkey, then they carry calm the system inside or what? Because people have monkeys as pets. People go to the monkey sanctuaries and things. As we did, we see say they the newsfeed. How it go? What he carry come? Because they.
Yes.
So what could be like probable causes? Like why are we beginning to experience some of these things? Like
okay, so monkeypox, the disease is actually called mpox now. Yeah, initially it was called monkeypox because its history. Yeah, so way back in the 50s. That was when it was discovered.
Okay.
And it was isolated in a monkey in Denmark, by scientists. Yeah, where the monkey had these pox-like symptoms, these rashes and stuff. So hence the name monkeypox.
Okay.
Yes, but then it's not only monkeys that transmit the disease.
Okay.
We have lots of animals that actually transmit the diseases, such as rodents, such as rats, exactly, mice and stuff, squirrels and stuff. Yeah.
So why then go name them after monkey? Why they don't name them after?
Yeah, if it's the monkey, then see for face. That's why.
I see some news item where they say it is prevalent in Sweden or something, where like people they get down for the masking and things. I read another article where they say Africa where they thrive. Like when they enter the Africa on a system, you check like they come. You do engagement farming or something like that. Why when a system will they suffer? Like what's they enable them?
When monkeypox virus was first isolated in a human in Congo, that was around the 1970s. There, it affected a 9-year-old person, child. Yeah. So since then, it has been thriving. It has been contagious. It has been transmitting from one person to another. Such that I think in 2022, 2023, yes, Congo had a very, very, very big hit. Yes. And it's thriving in Africa because we don't have the means to actually control it. Yes, because there are some procedures that you have to follow. There are some preventive measures you have to take. But then we are not doing it. You get it? Yes.
So when it enter the system, they just the ravage as they look.
No.
Okay.
So I think in Africa, per se, especially in the DRC, the first one that was isolated there is we have two types. We have the clade 1 and the clade 2. So the clade 1 was isolated in that region. And if you compare the two, that's the most dangerous one. Though it's self-limiting, but it's more dangerous than the clade 2. And the clade 2 is more in the West African regions. But people like, let's say, in Sweden and all those stuff you are saying, most of them are people who have traveled to these endemic areas. So
they travel to this side.
Most of them. Then they got it from here. Because the incubation period for the condition to is a number of days. If, let's say, I've come to Congo for, let's say, 7 days and I come in contact with it, I'm not going to show symptoms in that 7 days. So if I return back to Sweden, that's when I'm going to get the symptoms there. That's why people there are getting symptoms like that. But mostly it's hit in Africa. And because of the strain that occurs in DRC is the most prevalent and the most dangerous. And also, it also can lead to death. And also, as he rightly said, there are certain preventive measures that most of the countries, they lack. Their public health. So a lot of things, education, resources, and all those things to combat these things. They lack these things, and it becomes a problem.
For something where incubation period be more than a week. So if you get time, how you go know? Because you say like it's more than a week, right? So you go fit there your body inside. Then you don't know. Maybe you go get headache, then you go figure say it be normal and things. At what point you go start to know say, I do hear critical. Also, when do we start seeing those big wounds on your body? They go, they leave scars and things.
I think when it comes to incubation period, I think for the sake of our viewers, so incubation period is the period between the first infection and the presence of your first symptoms. So you can get the monkeypox, let's say today. But the rash will start maybe in 8 days' time. So if the 8 days is up and the rash appears, that's when you are becoming symptomatic. So within that 0 to 8 days, you can't even know that you are even sick because the virus is now preparing itself to fight against your immune system. So when it overpowers the immune system, then we are going to the syndromic phase. That's when you begin to show the symptoms.
So by like the beginning stage, you go feel like maybe you the sick where you go hospital where you say, okay, you know, you go say maybe I have monkeypox, but maybe you have headache, you have fever, you have this, I don't know the symptoms and things. But you go and the doctors go like, oh, okay, you have monkeypox. Then go feel like contain them at that stage without it getting to that level where your skin go start to do this thing.
Okay, so with the monkeypox, unless maybe you know someone who is a known case. So I know that, okay, let's say, Kwadwo Sheldon, okay, sorry for using you.
I know get some.
So maybe, let's say Kwadwo Sheldon is having monkeypox. I know. And I've come into contact with him. I know that, okay, I'm a direct contact. So definitely, I might show the symptoms. In that state, if I report to the hospital, even though I don't have the symptoms, they can quarantine me and show me the preventive measures to observe if I'll actually show the symptoms or not. Because not everyone that comes into contact will also show the symptoms. But mostly for us to know that, yes, you actually have monkeypox, you should be symptomatic.
Okay.
So when the symptoms mostly start with the rash. Some people will get fever, headaches, muscle pain, and all those stuff. Then it comes in. But even with that, because there's something medically called differential diagnosis, there are certain conditions that are similar to that. So the symptoms are similar. But with monkeypox, we have something that we call lymphadenopathy. I know my brother will elaborate on that. So the lymph nodes will be enlarged. So that's one peculiar thing that distinguishes monkeypox from the other poxes. And even with that, we have certain tests that we use to confirm that actually this is monkeypox. So you can't just use signs and symptoms alone to just
it will be different pox be okay. But so boss, make we go through like walk us through, let's say like top 5 signs and symptoms. Like okay, when you see some of these things for your system or your body inside, I mean say Charlie, you forget close to the hospital, or you push you for some room inside and stuff.
Okay, so mostly the main symptoms be the rash.
Okay.
Yeah, so it normally starts from the face. Yeah, then progresses down to
the face.
Yes. To other parts of the body. Yeah, and it starts as a very flat rash.
Okay.
Yeah, but as it gets worsened, it becomes like a blister.
Is it itchy?
It's
you don't get some before. I don't know.
No,
it's quite itchy.
Yeah, it's
okay.
itchy.
So is that why people scratch like then it becomes
like a wound and stuff.
Okay. Yeah. But then all scratching out like the fluid and things, you go touch some other place.
So
that be how you be. Okay. Yes. Even if you touch your own body, let's say the thing day here, where you scratch them, the fluids, there you go.
Yes.
Yeah. So you've inoculated the unaffected site.
Okay.
Though it's in your system, but if it occurs on your skin and you scratch, you are inoculating other parts of your body.
Okay.
So it means you are just transmitting the organism on those parts, and those parts will begin to.
So self-harm, you can also do it for other people.
Exactly.
Interesting. Okay.
Yes.
Boss.
Yeah. So that be for the rash. Yes. Also, you go get symptoms such as the fever, malaise, that's body weakness, muscle pain, back pain, and also sore throat. You can get sore throat as well. Yeah. I think that's basically it.
So that be okay. All right. So when it get to this stage, that be when you go to the hospitals and things, and you go make them take care of you wherever them. But then let's make we start from where we know they won't get to where some of these things, because the Ghana Health Service, they have issued a statement to the effect that we take care of on ourselves when it comes to some of these things. Now, for the average Ghanaian who they won't go about in this, sit in Trotsky, if somebody sneezes, they won't like normal thing. How we go fit safeguard on ourselves just on the surface level, because if you want to go deep then there's some crossover share but like what be like the basic safeguard measures where you go feel give you yourself. Okay,
so I think before we go to that, there was one thing that my brother maybe didn't add that I want to add to the symptoms. Right? So we have something called lymph nodes. So we have like 5 lymph nodes in the body that monkeypox will affect. So we have what is called the cervical lymph nodes. We have the axillary one, which is around this side. Then we have the inguinal, that's around the genitalia.
This one we want.
Then also there's the mandibular lymph nodes. So there's one here, there's one here.
Okay.
There's one this side. So any of them, depending on where the infection occurs, because with monkeypox, it can be transmitted through sex.
Hey.
Yes.
Wait, it's a viral. Okay.
Yes.
Wait. As in sex.
Yeah.
Raw.
So mostly even people outside.
No. Wow.
So people even outside Ghana, let's say Africa here, that had a lot of cases of monkeypox. The research showed that most of them, if it's men who engage in men-to-men sex.
My gender.
Yeah. So through the inner route, the vagina, the penis, because if the rash is on the penis and you get intimate with someone, you get it. If the person is having the virus and you have deep kiss with the person, because there's fluid contact, even if the person is having, you try to massage the person's sweat and all those things gets to you. And with the sex, either vagina, anal route, oral sex, even the use of sex toys.
Hey!
Yes. Because those things become contaminated. So if someone uses the sex toy and
Now the shades was she wearing.
that's one preventive measure, but it's not 100%.
It was on 100 degrees Fahrenheit crash.
So with that one,
I didn't know person logic.
no. Because because we come to the preventive side. So I think we will shift that to that side here.
Okay.
So it's sexually transmitted also.
Sexually transmitted. Oh, okay. So the boys for the WhatsApp group are more want to run. They say protect yourself. You know, be STI alone, chlamydia alone, monkeypox did the system. Okay, so let's enter the preventive measures. You understand?
So if these lymph nodes are enlarged, it will inform your healthcare provider. If you're a doctor, you just know that this might be a classical case of monkeypox plus the other symptoms that he said. So when it comes to the preventive measures, like coronavirus, the first thing you have to do is social distancing. That's one thing that you have to be very careful about. So you have to limit contact. If currently we don't have a case in Ghana, but if there's a case in Ghana now, there'll be contact tracing. Also, you advise social distancing, disinfection. You have to encourage hand wash. Then also, if you are someone who is having monkeypox or any other flu, you have to make sure that you wear a mask. Okay. Yeah, so that you don't transmit it to people.
Tell me, we go back to coronavirus era. but is it deadly like that? Like, because I've seen the wounds necessarily, man. But overall, is it deadly? Like it be something where we for fear.
You for fear. Yeah, but it's not to the extent of the COVID-19.
Okay.
Yeah, because actually, as he said, it's self-limiting. It can just disappear on its own, but you may have complications. Yeah, and these complications may include pneumonia, secondary infections, and a whole lot. So these ones can actually kill you.
Okay.
Get it? Yeah. So it's very, very important that we actually curb it. Else it might be very,
but do you think we are resourced enough to, face something like you are in the health sector? I'm not doing politics here, but I'm just asking a general question. If we recall like 10 cases right now, we did ground.
Well,
public health.
I think when the COVID hit, I think certain measures were put in place, and some of these measures and facilities,
they are still there.
Yeah, when they just modify them in tune of that, it becomes okay.
Okay.
But the first thing is to prevent even the first case from happening. That's why we are all here.
Okay.
Yeah, to sensitize the public. Yeah, that's one thing.
Okay.
Yeah.
But is there a vaccine for it though? Because almost all the other ones that we have experienced, they say vaccine. So is there a vaccine for this one?
Yeah, there's a vaccine for it. All right. The vaccine is for the smallpox.
Okay.
Yes. But then because of how the virus is, because they're in the same family, they're in the same genus actually, as in their brothers and sisters. So if someone who had smallpox is infected, there's something called the antibodies.
Okay.
Yes, and these antibodies, the body produces antibodies to fight them. Yes, so that's basically how vaccines operate. So with vaccines, they are like dead organisms.
Okay.
Get it? Yeah. So if you introduce into the body, then the body will produce these antigens, the antibodies that will fight it. Yes. So when smallpox came, yes, they developed a vaccine for it.
Okay.
Yes, and these vaccines were very, very potent. They actually worked. Yes, and because the smallpox and the monkeypox virus, they are in the same family, the same genus. If you use the smallpox vaccine, it actually works for the monkeypox.
Okay,
Yes,
so there's a vaccine for it at the end of the day.
There is.
Okay.
There is.
All right. Anything about
Yeah, so with the vaccine, I think there were 2 vaccines.
Okay.
But one is highly efficacious.
Okay.
Yeah, but currently I don't think maybe we have in Ghana here, but I think elsewhere.
We don't have it here. Yes, our question.
Oh, I think when the needs arise for vaccinations, because Ghana Health Service, Ministry of Health, they are in liaison with WHO and all those agencies. I think they have ways that they organize these things to come down. But I don't think that is in the system now. Yeah, but that one is for smallpox. I think it's the Genus vaccine. Yeah, that's the name of the vaccine.
All right.
Yeah.
So overall, like conversation, what would you like to, tell the people out there? Because I'm sure there are people out there who are afraid. Like they hear some of these things and they start panicking. You understand? The fear start the monger and things. What be that thing you would tell them to assure them? Say, yeah, we no go fit avoid some of these things because Charlie. First of all, we don't even know where they come from. You understand? But at the end of the day, we go still survive for inside if we take care of ourselves and things.
Exactly.
Yeah.
Exactly. So with that, there's one thing that I'll let everyone know. There are also certain groups of people who are highly susceptible.
Okay.
So we have people who have weakened immune system. So let's say someone who is HIV positive, who is not taking their antiretrovirals. People like that, their immune system are already down.
Okay.
If you get it by monkeypox, you are in deep trouble.
Okay.
Children less than 1 year, their immune systems are now picking up.
Okay.
People like that, when they get monkeypox, becomes a problem. Then also, there is another category of people. So people with chronic conditions, they are also at risk of these agents, because all these things, your immune system comes down. And also with pregnant women.
Okay.
Yes. So a pregnant woman can actually transmit the virus
to the
unborn baby.
Oh, okay.
During birth or after birth. So that's another category of people who have to actually take good care of themselves. Then also with the things that people have to know, personal hygiene is one thing that we should encourage. I know in our culture, everybody wants to handshake somebody, everybody wants to hug somebody, everyone wants to kiss somebody.
Hey, chairman.
So these things, when these things happen like that,
even my wife,
you can't be too careful because only her knows maybe
where she must go,
and you know where maybe you.
Oh no, me, I don't know anything.
Just let's be careful, like how we did in COVID.
Okay.
So let's practice safe hygiene skills, washing of hands under running water, because these virus, I think they get inactivated under chlorinated conditions. So like if you are using chlorine to clean your surfaces and all those stuff, it helps. So sanitizers, methylated spirit and all those things, these help prevent transmission of these viruses. And also, if you are sick, don't turn yourself into a house doctor.
What about Google?
Google doctors and house doctors, we discourage that.
Okay.
Especially most people, this thing, I do that. Say,
make a key in for Google. Okay.
Don't go and Google your symptoms. Okay. That's why your doctors are there for you. Just walk into the hospital, speak to your healthcare provider, they will assess you. Don't just say, this one is like chickenpox. Maybe you are having monkeypox, but you think it's chickenpox. So
yeah, but how you go differentiate the two though? Like monkeypox, chickenpox?
They be quite similar.
Okay.
Yes. But one thing about the monkeypox be the lymph node swellings.
Okay.
Yeah. So as you talk about the lymph nodes, wherever it is, so they are mostly found in the axillary, the genital areas, in the neck as well.
Why are you shy to talk about genital?
Yeah. So them places. So you go see say there are like some swellings around that side. Yeah, that makes it quite.
I can check my own. I'm straight. But this thing about this is off topic with it. But chickenpox, that there's this assertion out there that once you get it once in a lifetime, right? When you get it once, like maybe you be kiddie where you get in that. Is it true?
Oh, yeah, in most cases, that's how it is.
Do you need 2 hours?
Oh, no. Yes,
you know, be so.
Yes,
because most of the time, if you get those viruses, your body is primed to produce an immune response to the next infection. So it's like you're already known to it. Okay. So if you are getting exposed to it, it's like, I already have it already. So why should I be symptomatic? But if it's too much, sometimes you can get another episode of it, but it won't be like the first 1 year. That's how it is.
Chief, just add to what Senior Man here has said with regards to what we are supposed to do as citizens, because at the end of the day, even our health system, like it be overburdened already. So if this one can't compound it, so we for just help mitigate the whole thing. So just talk to them,
right?
Make them listen.
Yeah, one thing we not talk about be the mode of transmissions. We don't really exhaust that one. Yeah. So as I talk, the monkeypox or the mpox, it be zoonotic disease, meaning say it can be transferred from animals to man. Yes, and it can also be transferred from one human to another. That one we've exhausted that already. Yes, and the mode by which it can be transferred from animals to man is either by direct or indirect contact. That's ingesting the food, as in the animal.
So now we are.
So let's say you see when they drive for the Kumasi in Koko Kumasi stretch, then they sell a crantier for there. So I buy some. We are come house. We are ball. We are shame to shame. Still, problem D.
Oh, problem D.
Okay.
Problem D. Yes, because
It's a risk. Yeah.
Because he's talking about injection. So Miss Mary.
Sorry, you will get a disease.
And even if you get scratches from those
or even bites safe.
So those who go to the monkey sanctuary, assuming that monkey is having monkeypox and the monkey scratches you, you've been inoculated. That's another thing.
Even during the preparation of the food safe, if you get in contact with any of the fluid from the meat.
Because you have to cut it, boil it, and things. Okay.
Then also, I think there's one thing that we have to add with the inanimate object. So if I'm having monkeypox and I sleep on a bed, and someone comes to sleep on that bed, the person is going to get it. So surfaces, so if I have it and maybe I touch this surface, if I don't disinfect, that's what I was talking about, disinfection. So you make sure you disinfect, make sure you...
like we will talk for Mike inside, we go fit talk finish, somebody to go can't use them, the person go forget.
It's inanimate. If the person gets that contact, so we advise that you disinfect your areas most of the time. Door handles, the places that people normally touch and all those stuff, make sure that you disinfect it.
We go figure to the place where we wear the face shield. So then Crawford import here back country.
We don't go reach that level.
So like then you mention some of them.
So that's for the animals.
Yeah, the animal to human. Yeah.
Yes, and from humans to another humans, it's basically physical touch or direct contact. Yes, and also there's research that some schools of thought say it can be transferred through respiratory droplets, but then let's say research has not really proven that. Yes. So the main thing is physical touch. So either handshakes or even sleeping on the same mattress, sharing the same beddings, you can get the disease. And homosexuality. So yes, homosexuality. So having sex, anything that deals with contact. You get the disease.
But it's not only homosexuality. Right?
Oh no.
The other one too. Yeah. Same sex, different. Yeah. Okay, all right. So all these things. So chief directors, your last words to the boys for the WhatsApp group when it comes to monkeypox and why them for cool down, everything would be fine. I just need my audience to calm down because I've seen people tweet, make jokes about it, and but at the end of the day, what I've seen it down to people's skin. I mean, the way when I'm tossing them, rough, my bravo. Yeah, sorry.
Okay, so to everyone out there, just know that monkeypox is real. And if there is a global emergency, it doesn't mean that we have an active infection. Okay. But miscommunication is one thing that you shouldn't tolerate. Okay. And also make sure that if you have any queries or questions, you ask those in the field. And also practice safe sex, practice good personal hygiene as an individual, and also make sure that you observe people who are around you and encourage them to seek medical help when there is a need. Yeah.
See.
Yeah, so I think he has said
if you target the Twitter boys, because we will carry this part to go show when a doctor comes.
Yeah, so the preventive measures there, we have to be really strict on that. Actually, yes, and mostly for the government's part, as in the public health part. I think we didn't really exhaust much on that because the contact tracing and also the surveillance that's very, very important. Yes, and I think monkeypox is not so much of a worry, I must say. Yeah, because in Ghana we've not experienced any case yet. Yes, so I think everyone should just keep calm, just observe the protocols, just keep your distance, just watch around, observe people. Yes, even your own family members, because family members, those in the health sectors are also quite predisposed to having it. So I think everyone should just calm down and be circumspect.
Yes. And one last thing. make sure that you boost the immune system. That's one main thing.
And how we go boost them?
So you have to eat healthy.
Oh, okay.
Yeah, so eat a lot of vitamins. Yeah, green leaf vegetables. They contain a lot of vitamins.
But expensive.
But you have vitamin C.
Okay. Yeah. They be animal vitamins.
Oh no, but it's something that you should be taking.
What about that zinc thing, right?
So vitamin C with zinc, so it's part of the supplement that helps.
Is it advisable to be drinking it every day? The zinc that they put in water, and because there's someone in this office where you tell him, but you see the zinc. Your friend the Captain Zinc.
Okay, so I think too much of everything is bad, but
honest,
I think the doses that you consume with zinc is not too much of a worry.
Okay.
Yeah, but it's not something that you should be doing every day.
Yes. Like how you go feed they eat rice and consume they drink zinc water. I see some before, like for the office, but it's crazy anyway. Yeah, so ladies and gentlemen, boys and girls in the WhatsApp group, this is the basic information you need to know about monkeypox. The technicalities, you have to meet them in their respective places of work for them to expatiate on that. But the basic information is available in this video. Just protect yourself, take care of yourself, boost your immune system, practice safe sex, Charlie, and be looking out for signs and symptoms and everything. I'm sure as you discover them earlier, we go feel mitigate the impact and things. So I don't think it be something we all they come die or Armageddon they come. No. We all go day fine. So thank you very much, Chief. Thank you very much. But you for plug your the boys for come by.
It's you. For come.
Yeah, but then how this is going to be just the ending of the video.
Okay.
How are you so much interested in like selling some of these things? Like sometimes people come for you like it's one guy what's an award one man. Yes. So you're a medical doctor, right?
I'm a medical doctor.
Yes, but then all the time I come to you, I say, what was
yeah, the money did aside. Oh. Yeah.
He did aside?
Oh, he did aside.
Okay.
Because, Charlie, the work, he did pay. He did pay, but then Charlie, it's not so encouraging. So if you get some side hustle, if you take balance.
But they move the sneaker side.
Oh yeah, we did top.
As they right now to they create content, they do advert for brands and things.
Yeah,
they take we on a job. Me and Panion mean to me moving. I'm just my question white.
Bro, we forget about it for every side.
Above. So how people go get to you like if they want to follow you on social platforms?
Okay, so I'm mostly on Twitter as footwear_rack. Yes.
What would you do on Twitter?
yeah. And on Instagram, Noel, or let's say Noel_the plug.
Okay.
Yes.
All right. Chief.
Basically that.
Okay, so on TikTok, I'm connect with Dr. Greg. So I'm basically into health content. So I do a lot of videos on health promotion. Yeah, on Facebook too the same. So the connect is key.
Okay.
Yeah, connect to Dr. Greg.
Okay.
Yeah.
So a influencer content in Ibiza.
It's only about health.
Okay, it's about health.
Yeah, health promotion.
Brands.
Fortunately.
And the brands they should continue. All right, ladies and gentlemen, this has been an extension episode of Y'all of the Day. Disseminate the information and demystify whatever you want to get out from this video. By the end of the day, take care of yourselves because the subscribers and they need me pass. We be is here, and me views so better intimate. But anyway, take care of yourself. Thanks for coming. My name is Sheldon. We are out.